Hello, I am Dr. Rohini. Today I am going to talk briefly about ovarian cysts. So, cysts are nothing but basically fluid-filled sacs which are present in the ovary. They can be of varying size. They can be as small as 2 centimeter or as big as 10 to 20 centimeter. So, usually, what are the common complaints that a woman has when she develops ovarian cysts? In a majority of women, usually there are no symptoms. They'll not know that they have a cyst unless they come for a routine scan and we find that there is an ovarian cyst. But there are other symptoms, like some women can come to us, usually present to us with abdominal pain. They may have, if it's a hormone secreting cyst, they may have irregular bleeding. And also, some, in case uh, it's a cancerous cyst, then women may have other symptoms like they'll have bloating, they'll have change in weight, change in appetite. Sometimes the cyst, if it is too big, it puts pressure on the bladder and on the intestine. So women will also present to us with difficulty in passing urine or difficulty in passing motion or stools. So these are some of the common symptoms with which women present to us. And also sometimes they can also come with us with the complaints of infertility. Once patient comes with all these symptoms, first of all, how is the basic evaluation done? So basic evaluation is we will ask a history from the patient and then we will do an examination. We will see if there is any swelling in the abdomen. That will give us an idea, and we'll do an internal examination that will also give an idea whether there is any swelling. Then the next thing that we would do, it's a very important part of the evaluation, is the scan. The scan could be a transvaginal scan or it can be an abdominal scan. So transvaginal scan is preferred when the cyst is very small and the ovary is small. Then usually we prefer vaginal scan. But if we feel examining the patient that she has a very big mass or big swelling, then in that case we prefer an abdominal scan because it's easier to see from above when the cyst goes out of the pelvis. In the scan, we see for some basic characteristics of the cyst. Cyst can be, so our main aim is to diagnose and differentiate a simple benign, that is non-cancerous cyst, from a cancerous cyst. So the things that we would take into consideration when we see is that the size of the cyst, whether the cyst is present, whether the cyst is present in only one ovary or it is present in both the ovaries, and also if the cyst is just a simple cyst or it has a lot of septations. Septations means if it has boundaries within it, that also we have to see. And also we will see that if there is any solid areas in the cyst, then usually it is a sign that the cyst can be cancerous cyst. And also the size of the cyst, it can be more than 5 centimeter. In that case, there is more chances of malignancy or cancer. And also there are some other features that we look into. We just don't see the cyst, we see if the ovary is normal. At the same time, we have a look whether any other mass is present in the abdomen, or there is any fluid collection, which we call as ascites, which is also a sign of cancer. So next step is, one more thing is, we do certain blood tests. The aim of the blood test is again to differentiate whether it's a cancerous cyst or a non-cancerous cyst. So there are certain protein markers called tumor markers, which helps us in deciding whether it's cancer or not. So there are certain markers like CA125, AF, alpha fetoprotein, and carcinoma, or CEA, or beta HCG or inhibin. These are some of the tumor markers which help us in coming to a decision. So now coming to the management. So as far as management is concerned, it is important to see the age of the patient, the type of cyst that we have found on the scan, and also the tumor markers, and also the size of cyst. These things have to be taken into consideration. In case if we feel that we have any doubt with a scan or TVS, we need further evaluation, then we can send the patient to get a CT scan done also. So coming to the management, so depends if the woman is coming to us before menopause or after menopause. So when she comes to us before menopause, then we look at the scan. If the cyst is less than 5 centimeter, then we keep her on follow-up. We keep calling her every 6 months, and if the cyst size suddenly increases, in that case we offer her surgery. But there are certain situations where we have to operate the cyst. If suppose even if it is 4-5 centimeter, but patient comes with severe pain, then it means, because this cyst also has some complications. So like torsion is basically twisting of the cyst on itself. When this happens, patient will have sudden pain, and then also the ovaries blood supply may be suddenly cut off. In this situation, we will need an emergency surgery. So in case if patient has any of the symptoms like sudden pain, or if there is any pressure symptoms like she's not able to pass stools normally, or she's having difficulty in passing urine, in these situations, even if the cyst is small, we will operate her and offer her surgery. This is in case of a simple cyst which doesn't have any cancerous features. In that case, this will be the management. And as far as surgery is concerned, for ovarian cyst, we offer laparoscopic surgery. that is a keyhole surgery. Well, we'll put a camera inside the abdomen and we'll have a look into the other organs, and we'll just remove the cyst. If we feel it's a difficult case, then only we go for open surgery, that is laparotomy cystectomy. So now, in case if the cyst is bigger than 5 centimeter, then we see the tumor markers, and if there is any suspicion that there is some cancerous changes, then we refer the patient. We will refer the patient to a cancer specialist. We will not be for further follow-up. Now our management changes when a woman comes to us after her menopause, because after menopause the chances of getting ovarian cancer is more. At that time we look at the cyst, we get a detailed scan done, and we see if the look at the CA125 and other tumor markers, and we offer her surgery to just come to a tissue diagnosis. So the management for postmenopausal ladies is very different. Now there are some, this is the management for simple cyst. Now there are many kinds of cysts. A lot of women coming to the infertility clinic have this condition. So usually what happens is, this cyst is also called chocolate cyst. So what happens is, the lining of the endometrium, that is the inner lining of the womb, sometimes these glands can be present elsewhere in the body. It can be present in the walls of the uterus, it can be present in the ovary itself. And when it's present in the ovary, as cyclically a woman bleeds during her menstrual cycle, bleeding happens within the ovary also, and it forms a cyst called endometriotic cyst. Now this cyst basically reduces a woman's fertility by causing a lot of inflammation around the ovary, and it can also cause a woman to have painful periods and also have pain during sex. So when she comes to the clinic, we look at her, we assess her. In case if the cyst is bigger in size, or if she has other symptoms like pain during periods, then we decide on operating the patient. So I just gave a brief overview what happens. So in case, so this information video was that, because in case if you have any tummy pain, suddenly you have any difficulty in passing urine, or you have any difficulty in passing motion, or if you feel there is change in weight, appetite, you feel that you're not hungry anymore, you feel a lot of bloating, especially these things, bloating and change in weight, more important for women of postmenopausal women. So instead of ignoring the symptoms, you come to the hospital, get a scan done, just to make sure that everything is okay. So in case if you have any doubts, you can call us or come and meet us in person. Okay, thank you.